Hi, I'm Zach. I'm a rising PY3 at the University of Chapel Hill Pharmacy School.
Hi, I'm Kyle. I'm going to be a third year pharmacy student at Chapel Hill as well. So, what initially got me into pharmacy was I just had a general love for science as a kid growing up. I wanted to help people and I wanted to be involved in healthcare in some sort of capacity. I just didn't really know what. But I kind of noticed just kind of how integral of a role that pharmacists play with your community and helping out that community. I think that especially from like my family's point of view, like I've always seen the pharmacist as just somebody that you can go to for general questions and health concerns, and it's cliche to say, but they're usually like the last person you see as you're going on like a medication or new therapy. So they're definitely vital in providing some help to your community.
I've kind of always wanted to be a doctor, but I'm going to use doctor, not MD, because when I was actually graduating from UF, I had a chemistry degree, and I was at that time working at a myotonic dystrophy genetics lab, doing a lot of genetic work, and I was asking myself, what do I want to do after this? Do I want to go back to school or something like that? And I think just by sheer luck, I decided I didn't want to go into an MD program, and that I would prefer to use my chemistry skills for a pharmacy program. And really the ultimate line was looking at myotonic dystrophy in that lab and recognizing that as an MD, I wouldn't be able to actually solve the problem. Myotonic dystrophy is a disorder. It's a disorder that you can inherit, genetically speaking, that causes the degradation of your muscles. Kind of looking at genetics and recognizing that if I were to go to an MD program, I would learn how to palpate an abdomen, but I wouldn't learn how to manipulate genetics to produce a cure for myotonic dystrophy. And then I started thinking about cancer. What about cancer? I have family members who have died from cancer. Is there something I could have done with the research from a pharmacy degree? You know, that kind of stuff. So eventually I landed with pharmacy. But since joining pharmacy school, I've kind of reinvigorated, or it has reinvigorated, that idea of direct patient care in me. And so I'm super interested in direct patient care. That's where I want to land. And then I can use that for whatever. So it's been mostly working on projects. We are tasked with implementing a new CPP protocol for our site. A CPP is a clinical pharmacist practitioner, and we've been tasked with developing some of the groundwork to start that work.
Yeah, and in addition to that, we've been looking at a lot of the other facets that work in the FQHC. We've been going on home health visits, as well as shadowing practitioners to just see the typical workflow. I really learned about an FQHC through some of the lectures that I took at Chapel Hill. Just kind of knew that it was an institution that was really made to help out underserved communities, especially in rural areas of the U.S.
I would say the biggest challenge for me, somebody who grew up in a really large suburban city, was just coming to a rural area and then not really seeing these amenities that you would normally expect. But that's okay. I'm here to learn. I'm here to explore this community and meet people and figure out how I can best help with the future of healthcare. And that's why I think a location like this is so important. One of the first things we learn about in the Rural Health Scholars Program is the degree of rurality. And what that is how the government defines the amount of people that live in a specific area and the allocation of funds towards those areas. So the degree of rurality is super important, especially when we're thinking about healthcare. And you get to see that policy decision in real time when you come to places like Ahoskie, where most of the facilities, the healthcare facilities, are either university affiliates or federally qualified healthcare centers. So I think that is a great advantage towards understanding the healthcare system as a whole. especially when it comes to policy.
But I think it's also a great learning opportunity to kind of understand what challenges the rural communities face and how we're supposed to operate doing that. I think being in the FQHC gives you a great view of how an outpatient clinic is typically run in these areas. And I think it's something that you don't typically see in a lot of the areas that a lot of us would be familiar with.
The majority of the work that a clinical pharmacist practitioner does is in an interprofessional setting, working with mid-levels and physicians to provide health care. And primary care, the type of care that RCCHC offers, is a great opportunity to start learning how a clinical pharmacist practitioner might integrate themselves into that health care. So not only are you knowledgeable about the coworkers that you're working with, but because we're in such a small town, you also get to get close to the very patients that you are seeing every day. And so you have a little bit more influence over their lives than you would otherwise have in a larger city. Thinking about my most previous rotation, I had an internal medicine gambit where I was working with an endocrinology-based CPP, so she predominantly focuses on diabetes patients or patients with diabetes, and she was instrumental towards these patients getting insulin, managing insulin pumps and insulin or glucose sensors, and she was instrumental towards getting patients assistance for getting on GLP-1 agonists such as Ozempic, or instrumental in just these really mundane things that a pharmacist probably didn't need to be doing, but she cared a lot about her patients. She demonstrated a lot of empathy for her patients, but she also just genuinely wanted to care for them. Here we have North Carolina in particular is really high with the rates of diabetes, and so she wants to focus on diabetes. And there's a lot of tools that pharmacists can utilize to ensure that patients can manage their diabetes a lot easier, from simple tips and tricks about taking your blood sugar to providing you full-blown informationals about how a Dexcom sensor works. So I think her role kind of really reshaped the way that I view how a pharmacist can practice pharmacy. Something that I think is really interesting about our program, the UNC program, is that we give each other feedback a lot. And so I have gotten feedback that I was very disappointed about getting and very embarrassed about getting, but that moment kind of made me realize that I need to reset my boundaries, reassess my goals, and kind of figure out how I wanted to approach becoming a pharmacist. Because it's very important not only to have standards for yourself, but standards for which you present yourself to others. And kind of just that experience alone has triggered some growth that's necessary for me to continue my career.
Okay.
Yeah, and for me, more along like the lines of patient care, just kind of dealing and interacting with patients who are actively in pain or actively suffering. It's definitely an eye-opening experience, just learning how to navigate that, because a lot of the times they're not, when you interact with patients who are actively suffering or in pain, they're not in the best mood, and it could be really, it could take you aback, kind of just how to see how patients are interacting with you. But in the end, you have to realize that there are a lot of outside factors that these patients are dealing with, and that you're there to care for them, and that it's not necessarily a insult to you or how your profession or anything, but you need to uphold like your integrity in order to better manage your patient. A lot of my internships have opened my eyes to various areas of pharmacy through, there's been a lot of experiences where I just didn't really know that I was placed there, and I didn't know they even really existed. Like for example, I was put in an outpatient antibiotic clinic which I found to be extremely interesting and didn't even know that it was a role that a pharmacist could even play a part in. So just stuff like that, it's really just kind of opened my eyes to kind of imagine different areas of interest that I could pursue. I didn't think that I thought going into pharmacy, I thought that there was kind of like a straight line path, but it's really kind of open to you and to what your interests are. So.
Yeah, I think just kind of picking up off that last thing you said, when I first was applying to pharmacy school, I was thinking that, oh, this is just a straight path to working for CVS for the rest of my life. And slowly I started kind of unraveling that assumption. But as I've done these rotations and now I'm a third year, I've kind of realized that pharmacy can go anywhere, from business to law to healthcare. So you can do quite a bit with pharmacy, and I'm becoming more and more impressed with just exactly all the different niches that pharmacists can occupy.